Many factors can cause post-traumatic stress disorder, or PTSD, which can be totally disabling. Dr. Daniel Blocker, Director of Behavioral Medicine at Pomona Valley Hospital Medical Center, explains what PTSD is and how it manifests in patients.
PTSD is either direct or indirect exposure to a perceived life-threatening event. So this means you either directly experience it, you watch it happen to someone else, or you have been exposed multiple times to life-threatening conditions to other people. So for example, first responders. So PTSD manifests itself usually within set ways. Those ways include nightmares, intrusive thoughts, avoidance of certain places or things that are triggers of the event. Disassociation is a very difficult thing to kind of explain, but when you see it, you know what it is. And what it looks like is you're talking to someone and all of a sudden they start looking off into space because they're no longer in the room with you. They are in that place, in that moment that they were traumatized. One of the big misconceptions about PTSD is that it's a war-specific diagnosis, when the reality is that any time a person has been threatened in some way and they're having these symptoms, it merits the diagnosis of PTSD.
PTSD symptoms can last a long time.
Without treatment, PTSD can impact people for years, for a long time. There's two different types in the diagnosis world. The first is acute stress disorder, and that's when it occurs within the first 30 days. After those 30 days, that's when it becomes PTSD, because it can go away after 30 days. There are people who are exposed to these events and it never happens. They never have a PTSD episode. There are some people where they experience it 30 years down the road, they have a PTSD episode. There's no time frame specific to it.
There are varied treatments for PTSD, some of them high-tech.
The treatment for PTSD usually involves some level of therapy, specifically exposure therapy. They've made a lot of cool headway in this, where they have virtual reality simulators, where, especially for veterans, where they can reenact these war scenes that they had, these traumatic events, and learn to calm themselves down. The way I usually describe PTSD to patients is that their brain, because our brains are designed to keep us alive. Our brains can get stuck in moments where it feels extremely threatened, because its job is to keep that from ever happening. And so it continues to return to that thing. So by associating those threatening events with peace, with safety, it loses the association and it goes away. So the virtual reality therapy is one option. Another option is called EMDR. It's a fascinating, revolutionary way to address PTSD. The idea being that as you recite the event or as you think about the event, you almost hypnotically follow a light or a finger, or you move your eyes to a sound. And in that process, the traumatic event loses its power and it no longer affects people. There have been many people, you can see their testimonials online, who have had amazing experiences with EMDR. Beyond that, traditional CBT or cognitive behavioral therapy can be helpful. With patients who follow their homework assignments, who work and do what they need to do, therapy can be very successful in treating PTSD.